The Canadian Institute for Health Information's latest data shows a spike in the rate of youth hospitalized for eating disorders during the COVID-19 pandemic. CHEO says girls aged 10 to 17 with eating disorders were hospitalized nearly 60% more following the onset of the pandemic. Dr. Leanna Isserlin is the Psychiatric Director of the Child and Adolescent Eating Disorders Program at CHEO, a pediatric hospital and research center. And she says the number of hospitalizations is just the tip of the iceberg because so many more patients don't have access to care. Well, joining us now to talk more on this is Dr. Isserlin herself. Welcome to Forum Daily, Doctor.
Thank you.
So how has the pandemic impacted eating disorders among youth in Canada?
So youth in Canada have been struggling even before the pandemic with eating disorders as well as other mental health challenges. And we were struggling as a healthcare system to keep up with that long before the pandemic struck. And then with all of the stressors that have occurred for young people during the pandemic, we have seen a significant increase in young people presenting with eating disorders, as well as a general deterioration in the mental health of young people.
And you say the numbers by CHEO are just the tip of the iceberg. So can you tell us a little bit more about this?
That's right. So the CHEO data represent the hospitalizations for young people with eating disorders. And that's really important data. It's reflected in what we've seen here in our center. Clinically, we've seen the increase in patients presenting with eating disorders at 220% of what we had seen before the pandemic. However, just looking at the hospitalizations doesn't tell us what's actually happening in the community because many young people with eating disorders don't reach the point of receiving hospitalization or even receiving care.
What do we know so far about the causes of eating disorders among youth, especially during this pandemic?
That's right. So we know there are many risk factors for eating disorders, including genetics, societal pressures, other stressors that young people come in contact with as they move through adolescence, which is the time when people are most vulnerable to developing a new onset of an eating disorder. And then when it comes to the pandemic, we saw unprecedented incidents of isolation, transition, uncertainty, change, as well as exposure to screens and social media as really the only form of staying connected to the world. And all of that has had an impact on young people and increased the risk of developing an eating disorder.
And I'm sure the parents and guardians watching this right now want to know how they can identify if their child or adolescent has an eating disorder. So what types of eating disorders are there?
So there are many different diagnoses of eating disorders, including the classical eating disorders of anorexia nervosa and bulimia nervosa, but there are also other types of eating disorders, as well as young people who don't fit into a specific category, but have significant eating challenges that are impacting their physical health. And ultimately, at the root of the eating disorder is this sense of not being good enough and transposing that onto their body and trying to change their weight and shape in order to feel sort of good enough for the world, to raise their self-esteem and to be able to feel in control of their lives again.
So what steps can loved ones take to treat eating disorders among youth?
That's right. So loved ones are really important team members in the treatment of eating disorders. They're critical in being able to support their child or youth or even adults loved one with an eating disorder and at home. And it's also important to be advocating for increased resources and supports because we know that we have a critical shortage of resources available for young people with eating disorders.
Can you tell us a little bit more about these resources that are needed and what officials can do?
That's right. So we need resources for young people at all different levels and all different areas of children's health. Children's health has been chronically underfunded, and we're really, just trying to catch up with what we've needed for a long time. So we need officials to really make a big investment in children's health, to see it differently than adult health, and to recognize that an investment now in children's health is an investment in our future, because these young people, if they don't receive the care that they need, will go on to have chronic eating disorders, just like they will go on to have other chronic diseases, which will be lifelong if they don't receive timely care at this time.
All right, Doctor, just about a quick 30 seconds left here, but what are the current supports available for Canadian youth with eating disorders?
That's right. So we have many different levels, including things that they can access on the internet, our National Eating Disorder Information Center, There are community support centers in many large centers, and there are hospital-based systems, as well as children and family community mental health supports often have resources for young people with eating disorders. And, accessing your family doctor and pediatrician is always a good start when you're concerned about your child.
Dr. Isserlin, thank you again for joining us today on Forum Daily.
Thank you very much for your interest.